So how about some vaccine confusion? Let's talk about this after new recommendations. What parents need to know about child vaccines could get lost in the mix. Childhood vaccination rates are dropping across the nation, as you might know, and have fallen below 90% in some states.
Yeah, so the CDC says that's one reason behind these new guidelines. But today, some Western states are telling people the latest recommendations are too dangerous to follow.
A debate over childhood vaccines causing a rift over recommendations between the CDC and California.
It's really sad.
UC Davis Dr. Dean Blumberg says the new federal guidelines are based on politics instead of science.
The CDC traditionally has made these large decisions by vetting them, by having models to show what would happen if you made changes such as this, and none of this has really happened. So it really lacks any kind of scientific rigor.
Now California is joining 3 other states in a West Coast health alliance issuing their own immunization recommendations.
It's highly unusual for states to deviate from guidance from CDC.
Washington State's health director says the new federal guidelines drop some vaccines critical to keeping kids healthy.
The new schedule does not include vaccinations against diseases like rotavirus or RSV or meningococcal disease or hepatitis A or hepatitis B.
But the CDC says right now the U.S. recommends more vaccines than any other peer nation and more than twice as many as some European countries. They say decreased trust over vaccines is leading to an overall decline in immunizations, which has caused some recent outbreaks. The CDC is not changing recommendations for high-risk populations, and the decision is not expected to affect vaccines required by California school districts.
Immunization requirements for school entry are developed by the states, not the federal government.
Doctors worry conflicting views can be confusing to parents.
I think what I'd recommend, talk with your child's doctor. They're the ones who have your child's best interest in mind, not the politicians.
Now, the CDC says the vaccines will continue to be available for anyone who wants them and will still be covered by Medicaid and private health insurance.